Hello everyone. This PowerPoint will provide you with the basic understanding of budgeting and managing fiscal resources. By the end of this PowerPoint, the reader will be able to define what a budget is and list the three primary objectives of a budget, identify the three stages of a budget, and name three different formats of budgeting. So we will first begin by defining what exactly a budget is. Budgeting is the process of planning and controlling future operations by comparing actual results with planned expectations. According to Rundio, a budget has three primary objectives: to establish an annual and monthly budget, to identify and analyze actual experience compared to the planned budget, and to accurately report all financial and statistical data. Not only do large corporations do a budget, but we also do budgets every day, whether we'll realize that we're doing it or not. There are three stages of budgeting. The first stage of determining the budget is planning. Both nursing and the organization must review its objectives and goals to be able to identify the organization's priorities. There are many variables that need to be identified when it comes to planning an organization or a nursing unit's budget. These include demographics of the population that are being served, sources of revenue such as fundraising, government grants, things of that nature, wage and price increases, costs for new equipment, staff mix, such as how many RNs, LPNs, PTCAs does the nursing unit staff, regulatory changes, organizational changes, and statistical data. The statistical data that should be gathered includes the number of patient admissions, the average daily census and length of stay for patients on that unit, patient acuity, and the projected occupancy of the unit within a certain time frame. To determine the current budget, the organization should look at the past year as a starting point for projecting into the future. The second stage of budgeting is monitoring. According to Rundio, this stage involves resource allocation and management, identifying activities for realizing planning goals. For example, nurse managers may see that reporting during change of shift may take over an hour. This extra time spent in report results in overtime for the employee, which adds up over the pay period. To reduce the amount of time being spent in report, the nurse manager may implement bedside reporting. This results in less time being spent in reporting, thus reducing overall overtime for all employees. The third and final step is controlling the budget. Controlling is the process of comparing actual results with the results projected in the budget. The most commonly used technique to control the budget is variance analysis. When significant variances arise within a unit or within the organization, corrective action needs to be taken by the manager or CEO of that organization to identify what is contributing to this rise in the budget and how can we fix it immediately so that we do not go over our current budget. Organizations may choose their format of budgeting based on how they are structured. These structures include cost centers, revenue centers, profit centers, and investment centers. Nursing units are most commonly referred to as cost centers, but they could also be viewed as revenue, profit, or investment centers as well. The most important thing to note is that how the unit is being viewed is crucial to determining the nurse manager's approach to budgeting for his or her unit. Based on the type of center the unit is, the nurse manager may choose from one of the following when they go to construct the budget for their unit: incremental budgeting, zero-based budgeting, or a fixed or variable budget. Nurse managers may choose one format, or they may use a combination of all three of the formats. If a nurse manager chooses to use incremental budgeting, the finance department will distribute a worksheet listing each expense item or category on a separate expense line. The starting point for calculating the new budget may be the previous year's actual results or projected expenditures for the current year. The advantages to using this method is that it's very simple to use and offers consistency. The manager does not need too much training due to its simplicity. The disadvantage to using this method is that it discourages cost efficiency. The nurse manager must use the entire budget that was established for the current year because, think about it, this method uses the budget for the previous year as the starting point. So if she were to use the budget for this year, she needs to think this will be the baseline for next year's budget. On the slide, there is an example of incremental budgeting over a 5-year period. Zero-based budgeting, or ZBB, assumes that the base for projecting next year's budget is 0. The advantage to using this method is that all expenses must be justified. Managers must be able to justify all activities and programs as if they are initiated for the very first time. The disadvantage to this method is that it is very time-consuming, and multiple departments may need to be referred to when it comes to budgeting. Therefore, this method may not always be chosen every year by managers for budgeting purposes. On the slide, a zero-based budgeting example is provided by a monthly budget chart. At the top, the monthly income is provided, which is $5,860. The chart then lists monthly expenses, and after subtracting all the expenses from the monthly income, the balance is 0. There are also fixed and variable budgets. In fixed budgets, the amounts are set without regard to changes that may occur during the year. In variable budgets, the budget may be made during the year based on changes in revenues, patient census, utilization of supplies, and other expenses. Although not related to healthcare, the chart on the right provides a simple example of both fixed and variable budgets. Examples of a fixed budget, although referred to fixed cost in the chart, would include the house payment, car payment, and car insurance. The cost of those goods do not change. Examples of a variable budget, which is related to a variable cost within the chart, includes credit cards, food, and entertainment. The cost of those goods change every month depending on the monthly income. The operating budget, or annual budget, is an organization's statement of expected revenues and expenses for the upcoming fiscal year. The operating budget can be further broken down into revenue and expense budgets. According to Sullivan, The revenue budget represents the patient care income expected for the budget period. The expense budget consists of salary and non-salary items. The salary budget may be affected by salary expenses, benefits, shift differentials over time, on-call hours, premiums, and salary increases. The non-salary budget may be affected by operating expenses, office supplies, rental fees, and maintenance costs. Most hospitals may have a capital budget. According to Sherman, the capital budget is a projection of the planned cost of major purchases, including equipment, maintenance, renovations, and new construction. Organizations typically use a price point, for example $1,000, as the cutoff point for placing these items in the capital budget rather than the operating budget. Priority is given to those purchases that are needed most, and not all items within the capital budget will get the funding needed in that fiscal year. Johns Hopkins Medicine offered a look into their books for the fiscal year 2015. This offers a great example of capital budgeting. Control and click on the link to view how they could determine the budget for the fiscal year of 2015. As you can see, Johns Hopkins is operating on a very strict budget. Their revenue is indicated at $7.2 billion. If you scroll further down on the spreadsheet, you can see that they begin to allocate funds to different areas or different units. This is giving priority to those who need it the most. But it's important to remember that not all funding that's indicated for certain units will be given that were given priority will get the funding within that fiscal year. The future of healthcare remains to be uncertain. In the new budget proposed by President Trump, major cuts to Medicaid, the National Institute of Health, Centers for Disease Control and Prevention, the Food and Drug Administration, and Planned Parenthood are in the works. These cuts will most definitely affect all areas of healthcare. With payment incentives today focused on the value of services and healthcare outcomes, we as nurses are expected to do more with the few resources we are given. We must use our critical thinking skills and be involved in quality improvement projects within our unit so that we can continuously provide high-quality care to our patients. This will help our units stay within the means of our organization's budget.